Hello and welcome to Insights in Action with Orange 142, where we interview agency leaders and business owners and doctors and anybody under the sun that you can imagine to uncover the journeys, the strategies, and the insights that drive their success. At Orange 142, we're all about transforming brand stories into impactful digital experiences through innovative media and marketing solutions. And today I'm very lucky to be joined by Dr. Darrell Ballinger of Kettering Health. How's it going, Doc?
Doing well. How about yourself?
I am great, and I'm very excited to have you on. And I love starting off just by understanding some backgrounds. And Doc, what brought you to your specialty and being a podiatrist? What kind of got you into that?
So, my father was an obstetrician gynecologist, so I've been around the medical field through him, but I was also a soccer player. So I thought,
Hmm.
hey, working with my feet, maybe I'll work on some feet.
Yeah.
But I thought I initially was going to be working with sports athletes, but my journey is taking me really into the realm of wound care
Mhm.
and with hospital-based management. So I've been practicing for the last 15 years in the Dayton area, and it's been a great journey. And I always encourage people, if you want to lead the life that I live, I've got a lot of options for you.
Yeah, that's awesome. And there's something unique about you because you emphasize that no one should walk in pain, which I totally agree with. But can you elaborate on how this philosophy influences your diagnostic and treatment strategies for patients with foot and ankle issues?
So certainly, I always look at it as when we are looking at treating the patient, you treat the whole patient.
No.
So the psychosocial issues, we also ensure that once we are diagnosed with a particular diagnosis, are there any extenuating circumstances that's going to affect how you manage? So, for example, if you have a painful bunion, do you
Mhm.
have diabetes? Are you a smoker? How many steps do you actually have in your house?
Uh,
All these little things make it so if you have a painful bunion and I need to do a surgery, I'm taking those into account so that way we can get you to walk without pain.
wow. And do you think that's where medicine is moving now to look at a patient holistically? But because that certainly wasn't the case maybe 20, 30, 40 years ago, right? There was this like, hey, here's the problem I'm having. Please prescribe me a solution. So do you think that other people are starting to think that the way you are in medicine?
That's certainly where training is going. The training for medical students and residents are going in a more holistic manner, but
Mhm.
that's also because of the way we are changing how physicians get paid. And part of it is how hospital systems get paid.
Yeah.
Currently, we're looking at what we call lump sum models. In
Mhm.
other words, insurance companies or Medicare will give a system a lump sum of money to manage patients.
Mhm.
Part of how you manage patients is currently we're fee for service. So every time you have a problem, you see the doctor gets paid on that service date.
Mhm.
If you have a lump sum model, how doctors get paid is they get paid a big old bag of money
Mhm.
ahead of time, and then you are managing those patients with the money that you've been provided ahead of time. So how do you do a good job of that?
Mhm.
Taking patients holistically, saying, all right, where are they living? What are their psychosocial problems? How do I get them to take their medications on time? Do they know how to take their medications?
Mhm.
All these little things can help get that patient to not spend as much money in the healthcare system.
Mhm.
And for me, I always tell my patients, your goal is not to see me.
Yeah.
I work with wound care.
Mhm.
So unfortunately, in my area, I do the most amputations. So
Yeah.
for my county. And I
Mhm.
always tell folks, your goal is not to see me. So how do you not see me? Let's face it. I want them to understand is I'm going to get your primary care physician and all the other doctors to work with me. So
Mhm.
that way you minimize the amount of time you have to see me in the hospital.
Yeah.
You can minimize risk for like amputations by having people encouraged to have a better diet, better exercising, discontinue smoking,
Mhm.
not do drugs.
Yeah.
These things, like it keeps you out of the hospital. It keeps you from seeing me. And
Yeah.
that's what I want to be. I want to make sure that people aren't hurting when they're walking, but in particular, because I do wound care and that's my primary focus, my goal is to make sure that people don't have wounds.
Yeah. So what are some, as being a specialist in wound care, what are some of the common challenges that you encounter that maybe you haven't mentioned yet? And what innovative treatments or techniques have you found that are most effective?
One of the things that people don't quite realize is that the quality of healthcare has improved dramatically. And in particular, let's say in the 1960s and 70s, if you had a cardiac condition, if you were 60 or 70, you would have a heart attack or you would have a stroke and you would die. And nowadays, we have medications to help you. Your
Mhm.
heart is one of the things that we have developed so many drugs and techniques to improve your health, from cardiac catheterization to medications that help thin the blood. So that way, if you have a heart attack, we can really put a stent in
Mhm.
and we can bust clots in the brain. So that way, your stroke is not as severe.
Mhm.
Our technology for blood thinning agents has improved the quality of people's cardiac lives.
Yeah.
But that doesn't mean that it has improved the quality of life overall.
Mhm.
Unfortunately, we have improved the lifespan, but not necessarily the quality for folks. So, yes, we helped your heart,
Mhm.
but now you have artery disease in your legs, and
Yeah.
your blood flow from your heart to your toes is poor, and now you're getting these wounds. And now these wounds get infected, and now we're having amputations.
Yeah.
Some of the best devices to help me have been improvements in antibiotics. We have had improvements with hyperbaric oxygen therapy, and
Mhm.
we've had improvements with biological medications topically that we can use to help heal wounds.
Mhm.
All of those things are fantastic.
Mhm.
But the challenge that I see, especially today, especially with the baby boomer generation getting older and taking more and more of these medications, are that hospital systems have to realize that we're going to do a great job taking care of their hearts, but everything around else around them may be falling apart.
Mhm.
So when I recommend to physicians or administrative hospital systems, and I do lecture series and I try to educate a lot of the hospital administrative body saying, hey, what are you going to see in the next 5 to 8 years? It's going to be a lot of individuals on blood thinning medications having wounds. It's
Mhm.
going to have higher rates of diabetes in regards to some of their older patients because their pancreas is not functioning like it used to.
Yeah.
What can we do as a hospital system? And
Yeah.
the thing is, you're going to have to hire teams of wound care specialists to really help manage these individuals so they can live the best life they can live. Because I always say, if you're managing the whole body, you're going to do a better job. And you have to have a team in order to do. The
Yeah.
question is, who do you have on that team? So, first and foremost, of course, primary care. But when it comes to the hospital system, you're looking at a vascular surgeon, you're looking at cardiology, you're looking at infectious disease, you're looking at orthopedics. But also, I recommend that hospital systems hire a podiatrist.
Mhm.
We're generally one of the specialties that get to see people at an issue where it's like, oh, my toe came in and it's looking real dark. That's gangrene. It's not just real dark.
Mhm.
You have to address your gangrene systemically. So this is why I'm saying when I talk to other hospital administrators or I'm giving lectures, having a podiatrist for your system is significantly helpful.
Yeah. Wow. Yeah. As you talk, I'm just like, man, really, it's going to take an army to create change. And I think a lot of ways, you're right. It's starting to happen. And not only on the doctor side, but also on the patient side. I'm really curious to see as these new generations step up. I come from the millennial generation and the generations younger than me in the Gen Z and like we're not so about eating like terrible foods that in the past may have overeating may have caused diabetes and whatnot. So it's really interesting to see both the healthcare system and just like the way that society is moving. Hopefully, it starts to bring an end to a lot of these diseases and issues, right?
That would be the hope.
Yeah.
Once again, I look at it as the American lifestyle. We are sold, hey, this burger here, it's fantastic. You want to have this.
Yeah.
Also, we are sold, hey, you know what? We do have these pills that are going to help you. So you don't necessarily need to exercise.
Yeah.
And I'm going to be the one that says, as much as I'd love to say we have development and education in regards to, hey, we can do better with healthcare, we have a whole entire side of our American economy that is dedicated to excess.
Yeah.
Well, there's that dichotomy. And my thing is, as much as people want to live their best life, I say no. Live your life in moderation.
Yes. Yeah.
People who live their best life tend to see me. And I have said before, your goal is not to see me.
Yeah.
So,
You're absolutely right. And it points to, I don't want to get all sociological, AJ, but it does point to a lifestyle that we live of like instant gratification. And that's why oftentimes patients end up having to come see you, right?
absolutely.
Yeah.
So, and once again, one of the things that I always try to reiterate when I see patients and I see grandparents bringing in their kids, I say at some point in time, if your kid wants to be a physician, see how these things work, part of being a leader is making sure that kids have the opportunity to see what you do and then hopefully do what you do in the future. Because at some point in time, somebody's got to replace me
Right.
because I can't be the only doc in a block doing this level of work. I cannot.
That's a good point. Does that, I know that you work with students at Central State University. Is that what kind of motivates you to engage in this type of outreach and have the impact that you're hoping to have on future doctors?
Absolutely. I speak at University of Dayton, Central State University, the residency programs throughout our network, family practice docs, general surgery docs, other podiatry residents. I have them rotate through my wound care center.
Mm.
And once again, even through high school students in this area, I am first and foremost saying, you all can do this.
Yeah.
This is an opportunity for you to be the best person you can be.
Yeah.
And my thing is, if you are a leader, your goal should be, I should not be the only leader.
Yes.
Someone has to step in and fill in your shoes.
Mhm.
So once again, I may have people who have lived their best life and may not be doing too well, but I always encourage them, I'm here to help. I'm here to get you to where you want to be. And if you have a family member who's younger, doesn't know where they're going, you know what? I've got no problem teaching them how to get here.
Yeah. Yeah. And on that note, like looking ahead, what trends or innovations in your field are you most excited about, and how do you plan to integrate them into your practice?
So right now I'm looking at a study for smoking cessation. I'm looking for devices that are non-nicotine, that are basically inhalable type devices that aren't like the vapes that we have with significant amount of nicotine in them.
Mm.
So if I can start looking at devices that help people quit smoking, that's fantastic. I'm also looking at working with other surgical specialties like bariatric surgeries. For example, and people don't quite understand and realize this, we've had multiple studies that have confirmed approximately 47% of individuals who get a diabetic foot ulceration will be dead in 5 years.
Wow.
47% with just a diabetic foot ulcer
Wow.
are dead within 5 years. I don't think people quite understand that is worse than most cancers.
Yeah.
And like I said, with diabetes in the Americas being still actually relatively quite high, that's a lot of people who prematurely die. And a marker for that is your diabetic foot ulcer. My goal is to work with some of the bariatric surgeons to see if we can help decrease the amount of diabetes prevalence by having a surgical intervention.
Mm.
So, for example, when we have gastric bypass surgery, a lot of patients that have had type 2 diabetes have their type 2 diabetes reversed.
Mm-hmm.
I want to see what's the life expectancy post gastric bypass, and if they've had previous history of ulcerations in their lower extremities. So we're talking about having general surgeons with fellowships in bariatric surgery, working with podiatrists to determine if, you know what, maybe doing more bariatric surgeries in conjunction with seeing podiatrists on a more frequent basis helps to extend life and hopefully improve quality.
Yeah.
But these are types of things that's like multidisciplinary type work
Mhm.
is the future of medicine.
Yes.
So it's not just cardiologists in the journal of cardiology. It's not just endocrinologists in the journal of endocrinology. No, these are specialties working together to see, hey, what can we do here to improve the quality
Yes.
of patients' health?
Yeah. And in that situation, everybody wins, which is great.
Oh, absolutely.
And the patients win. Doc, this has been great, very informational. I feel like I learned a lot. It's awesome. I mean, where can people learn more about you or some of your programs?
So ketteringhealth.org, you can look at the wound care centers or podiatry. My team is available through that. And once again, Kettering Health Network is who I work through. And I'm always looking to improve the quality of the care we provide.
Awesome. Thank you so much for being on. This is great.
All right. Thank you.